Informed consent. How to incorporate into your practice. Imposing the requirement of informed consent seems a bit intrusive to many chiropractors. It directly implies an element of mistrust and a prejudged litigious behavior on the part of your patient, thus starting off on the wrong foot. But the intention is really as simple and practical as bilateral communication. Informed consent is, for all intents and purposes, a contract with your patient, but it isn't one-sided. In addition to informing them of what you do and how you'll proceed with their assessment and care, it represents the patient's best attempt at conveying information you need to make decisions regarding their care. By acknowledging this bilateral agreement, it's possible to keep both parties informed and, in essence, trusting of each other through full disclosure. This requires a bit of pre-planning with regard to what you and the patient need to know. What is a gray area is how much needs to be discussed by both parties and in what detail. For example, one element that is considered necessary is what the patient's alternatives are to your care. Well, clearly the details of pharmacological actions of specific medications, or the details or process and logistics of specific surgeries are beyond what is reasonable to expect. So how far do you go in this explanation? Being practical, what would you want to know as a patient, and frankly, what rights do you have? What is interesting is that we find ourselves on both sides of the fence, given we are, at times, a patient, which should make us resonate with the issues, and therefore make the process a little more tolerable. So what seems reasonable from the patient's perspective? So you're the patient. What do you think is wrong with me? What do chiropractors do, and what are you proposing to do? How often do I need to come in and why? Do I need x-rays? How much is this going to cost? How long will it take for me to get better? I heard something about stroke and chiropractic neck adjustments. Is this dangerous? Well, it sounds nagging listed like this, but as a whole, it's hard to recognize what would be offensive about answering these questions. The questions are reasonable, they're common, and much of it can be done in written form through anticipating these common questions. The only sense of offense is if you feel you're being challenged. But this isn't about you. It's about your patient's need to understand and be comfortable with what you're proposing, often during a time when they feel vulnerable and confused. Patients want more than to be informed. They want to feel in control, which is ultimately their right. To feel in control, it's important to be given enough information to make an informed decision. In this regard, you're more their health advisor or coach than their parent. What's changed over time is father doesn't necessarily know best. We've come a long way from Marcus Welby, MD, with total and complete trust of your doctor. Consumers have choices and need to make informed decisions. And yes, society has become more litigious, so there is some self-protection embedded in this process. In addition, public opinion generated by the popular press's need for sensationalizing for a headline causes us to be even more careful. So, as contentious as informed consent seems to be, it appears that many national groups such as the ICA, ACA, and Canadian Chiropractic Association agree on the following as part of what a patient should be informed of: their diagnosis, prognosis without treatment, treatment plan, benefits, risks, and alternatives. These, in fact, form the foundation of a good informed consent. So what happens when this becomes a legal debate with specific cases and judgments? There are basically three perspectives, each used by different states. One is what a reasonable clinician would say about the treatment. In other words, their judgment call as to what is relevant to the patient in front of them, supported by the opinion of their peers. Next, what a reasonable patient would want to know about the treatment, a judgment of what a patient would find relevant. And what a patient would need to know in order to make an informed decision, meaning someone determining after the fact what should have been anticipated as relevant, a little like needing a crystal ball. So let's look at some of the legal precedents, starting as far back as a Supreme Court decision in 1914. In 1914, the U.S. Supreme Court ruled that every human being of adult years and sound mind has a right to determine what shall be done with his body, and a surgeon who performs an operation without the patient's consent commits an assault for which he is liable to damages. In the 1999 Matthies versus Mastromonaco decision by the New Jersey Supreme Court, the court's decision emphasized the right of the patient to receive no less than a complete array of relevant information from the attending physician. Quote, like the deviation from the standard of care, the doctor's failure to obtain informed consent is a form of medical negligence. Recognition of a separate duty emphasizes the doctor's obligation to inform as well as treat the patient. In Connecticut, the law requires all healthcare providers to obtain informed consent prior to initiating treatment. However, the Connecticut Board of Chiropractic Examiners ruled that stroke-specific informed consent was unnecessary. Under the California Code of Regulations Title 16, Division 4, Article 2, it states, a licensed doctor of chiropractic shall verbally and in writing inform each patient of the material risks of proposed care. The chiropractor shall obtain the patient's written informed consent prior to initiating clinical care. The signed written consent shall become part of the patient's record. So what is material? They define material as a procedure inherently involving known risk of serious bodily harm. Clearly, this is where the debate lies. Connecticut ruled that the risk, although present, was too rare an event, and there was lack of evidence of direct causation to require informing the patient. It's still untested in California as to whether this will be a winning defense. Most would advise to err on the side of caution. A recent article investigated the use of informed consent for low back pain patients at chiropractic college clinics. The point here was whether newly minted chiropractors are prepared both in mindset and training to follow an informed consent process. Here it is, Shared Decision-Making Through Informed Consent in Chiropractic Management of Low Back Pain by Dejanay, Brady, and Haldeman. Using a rubric approach to evaluating the informed consent process and forms at these colleges, the conclusion was that improvement is needed. The article, although not dealing with the elephant in the room, VBA, does deal with the concept of informed consent, starting first with what is considered essential. The bottom line? No surprises. What is the condition? What is the treatment? What are the potential harms? What are the potential benefits? And what are the alternatives? Specifically for the condition, patients' interests are, what do you think is causing my problem? Why do you think so? What happens to me over time if I do or don't get treated? For treatment, what are you going to do to me? What are you actually trying to do? Does it hurt? How often do I need this and for how long? How much is each treatment going to cost? How long does it take? And how long before I feel better? As a summary overview, the elements that are essential are a discussion of what chiropractic treatment consists of in your practice, the common adverse events that occur with the treatment you will render. Including the most serious and rare is still in debate. However, including a statement about stroke is advisable in most states. A brief discussion of alternatives to your care should be included. What the treatment plan and prognosis are, including a description of what that opinion is based on, should be part of a patient's information. There are many examples online regarding informed consents. Links to some of these will be found on the resource section of this video. We'll take one example to illustrate a good template that you can modify based on your needs. Let's start with a description of what chiropractic is. The doctor of chiropractic evaluates the patient using standard examination and testing procedures. A chiropractic adjustment involves the application of a quick, precise force directed over a very short distance to a specific vertebra or bone. There are a number of different techniques that may be used to deliver the adjustment, some of which utilize specially designed equipment. Adjustments are usually performed by hand, but may also be performed by hand-guided instruments. In addition to adjustments, other treatments used by chiropractors include physical therapy modalities, nutritional recommendations, and rehabilitative procedures. Chiropractic treatments are one of the safest interventions available to the public, demonstrated through various clinical trials and indirectly reflected by the low malpractice insurance paid by chiropractors. While there are risks associated with treatment, these are seldom great enough to contraindicate care. Referral for further diagnosis or management to a medical physician or other healthcare provider will be suggested based on history and examination findings. Listed below are summaries of both common and rare side effects and complications associated with chiropractic care. For common, reactions are usually local soreness, discomfort, headaches, tiredness, radiating discomfort, and dizziness, the vast majority of which resolves within 48 hours. For rare, fractures or joint injuries, physiotherapy burns, disc herniations, cauda equina syndrome, and compromise of the vertebral basilar artery. However, this associated risk is also found with consulting a medical doctor for patients under the age of 45 and is higher for those older than 45 when seeing a medical doctor. The patient is then instructed to please indicate to your doctor if you have headache or neck pain that is the worst you have ever felt. Now to the common fear expressed by chiropractors that including a statement about stroke will cause patients to refuse care. A small study in chiropractic and osteopathy in 2010 surveyed practitioners. It was estimated that those that included statements about stroke had a withdrawal rate of only about one patient for every 2 years in practice. Here are the references for these statements. You can certainly include them in the printed content if necessary. From the patient's perspective, the form lists the understanding of benefit and risk, the expectation of referral if unsuccessful, and a list of reasonable alternatives and the risks and benefits. Here is a short but comprehensive summary that includes for the patient an understanding of the alternatives to care, the risks of not getting care, and most importantly, a statement about the natural history of spine pain and the directive to keep active and positive. Don't assume the patient will inform you of what you need to know. Remember, you may be judged on what you should have determined as relevant. Let's look at a checkoff list that will more guarantee that the information that affects either your diagnosis or modification of care are known to you, and you can discuss these issues further with the patient. Generally, it is important to ask if they've ever had an adverse reaction to or following chiropractic care. For modifying one's treatment, questions about bone health are important. Have you been diagnosed with osteoporosis? Do you take corticosteroids? Have you been diagnosed with a compression fracture? Have you ever been diagnosed with cancer? And do you have metal implants? Now, for determining the risk of bleeding and potential vascular weakness, do you take aspirin or other pain medications on a regular basis? If yes, about how much do you take daily? Do you take warfarin, Coumadin, Plavix, or other similar blood thinners? And for conditions that may be related to vascular weakness and possibly putting an individual more at risk for dissection, asking, have you ever been diagnosed with any of the following disorders or diseases? And finally, have you ever become dizzy or lost consciousness when turning your head? For potential spinal compromise or instability, have you had spinal surgery? If yes, when? Have you been diagnosed with spinal stenosis? Have you been diagnosed with spinal listhesis? And have you had any of the following problems? Sudden weakness in the arms or legs, numbness in the genital area, recent inability to urinate or lack of control when urinating. Finally, and most importantly, the process needs to be completed through a summary tied to their treatment plan. Inform the patient in writing with a clear expectation of what to expect, what to do, and what not to do, and give them a copy to refer to when they're not in your office. Here's an example. It includes the patient's name, date, and a summary of both where you feel subluxations are found, their diagnosis if other than subluxation, and any problems you intend to monitor, such as high blood pressure. Next, you see where we close the loop. There's a transfer of information from the informed consent so that it translates into any modifications or cautions you need to give the patient regarding their treatment. And finally, the actual treatment plan, which you could divide into 2 phases with an indication of frequency, chiropractic techniques, and any physiotherapy that will be utilized. A written list of what to avoid and what to do is a valuable reminder to the patient. It's always important to indicate expectations of improvement, probably best from a percentage viewpoint. An example might be an expectation of at least 50% improvement after the first week of care. Indicate that improvement will be measured by the patient's impression of improvement, measured by a region-specific questionnaire such as the Roland-Morris and Neck Disability Index. One way to guarantee an understanding from your patient that they have rights but also responsibilities is to provide a patient's rights and responsibilities document. This is common in hospital care. Among the patient responsibilities listed by the National Health Council are pursuing a healthy lifestyle, actively participating in decisions regarding their health care, and cooperating on mutually accepted courses of treatment. This tends to be more clearly illustrating the synergistic relationship that should exist between the doctor and the patient. Now we're complete with both parties exchanging relevant and useful information upon which both can make decisions and recommendations. This transparency is what informed consent should be about.